Periodontal disease, also known as gum disease, affects about 47% of the U.S. population. Healthy gums should have no pain or discomfort, as well as no bleeding. The beginning stage of periodontal disease is known as gingivitis. There's typically no discomfort with gingivitis, however, clinical signs may include red, swollen gums that bleed easily. The main cause of gingivitis is poor oral hygiene, which allows bacteria to stay on the teeth and eventually infect the gums. Gingivitis, however, is reversible with better brushing and flossing habits. Untreated gingivitis can lead to periodontitis, which is a chronic inflammation of the gums and bones surrounding the teeth. Plaque is a white sticky biofilm where bacteria resides. If this plaque is left undisturbed, it can spread underneath the gums, allowing the bacteria to colonize even further. The bacteria produces an acid-releasing toxin which can cause destruction to the ligaments which connect the gum tissue to the bone. The gums begin to pull away from the teeth, causing deeper pockets that trap even more bacteria. At this stage of periodontitis, it is nearly impossible to clean out these pockets with brushing and flossing alone. This is why it's important to seek the help of a dental professional, because the longer this bacteria stays underneath the gums, the more aggressive it becomes. As dental clinicians, we rely on a clinical exam and x-rays to properly diagnose periodontal disease. During the clinical exam, we take measurements of the gums. Pocket depths from 1 to 3 millimeters are considered healthy. However, anything over 3 millimeters is classified as periodontitis. As I mentioned before, gingivitis is the first stage of periodontal disease. This stage is still reversible. However, once it develops into periodontitis, it becomes irreversible. There's no cure for periodontitis. However, there are things that can be done to slow down its progression. More aggressive periodontitis will require to be treated with deep cleanings, or what we refer to as NSPT. Because NSPT is more of a deeper cleaning, it does require the use of local anesthetic. NSPT appointments are divided into 2 appointments. For the first appointment, we'll numb up only half of your mouth and clean underneath your gums. You'll come back for a second appointment where we'll numb up the other half of the mouth and clean underneath the gums as well. Typically, 3 weeks later, we'll have you come back for a final appointment. In this appointment, we will reassess your gums and your bone levels to see how your gums have healed after the therapy. Antibiotics may also be used in combination with NSPT. This is typically more common with site-specific infections underneath the gums. More frequent dental visits may be recommended, and those can go from 3 to 4 months depending on the severity of the disease.